So we're here with Eduardo. He's on his very own machine, and he's going to explain a little bit about exactly what he's doing. Eduardo?
Yes, when we try with this machine, what we do is to analyze the whole body, how it's moving in the space. Then all we do, we can measure the angles, the speed, and the degrees that we are moving in our inversion, the spine, knees, hip, ankles. With this, we can calculate the probability to have an injury. This is a highly accurate device to prevent some injuries. And also, when we have an injury, what we can do is to analyze which is a mechanical disorder that is causing this injury.
Yeah.
And this is what we mainly do. Then this is very useful because it's not only a statical measurement, it's also a dynamical measurement. And we also can do running or practicing any sport gesture.
You can just do this machine at a walk, also at a run, and you can make predictive ideas of where an injury will occur, and then you can sport and focus that. Can you also talk a little bit about identifying early pathology?
Yes, for example, when you have lateral discrepancy and you're doing like this, then you are provoking a scoliotic attitude. This scoliotic attitude is what is going to give you in some years protrusion or discal hernia, and then we can prevent it because we can see which is the main cause of this scoliotic attitude and what's going to happen.
Awesome.
Before it happens.
Do you also do this in any way, or maybe think through the idea of early neurodegenerative disorders that may appear first as a gait abnormality, but its etiology is in the brain pathology?
Yes. Then the main idea of this kind of treatments that we do when we analyze this is we analyze the instability, and then what we try to give them is some stability. For example, Parkinson. The people have the immobilism trying to move, and there's not a fluid movement, and they lose. The first they do is to lose the balance, and then what we try to do is to give them balance, and then they don't need to be in that way modifying their position, and they can have a more fluid walking.
We see ever so many patients in our clinic, and the first symptoms and signs of neurodegenerative disorders are not necessarily intellectual cognitive decline, but motor disorders and gait, early slight gait, and each neurological disorder almost has its own signature gait abnormality. Could this machine be even more subtle and pick up earlier, do you believe?
I don't know if pick up earlier, but identifying an earlier stages, yes. Because one of the things we see is the flight time and the time that the foot is on earth, and then the instability they have, we can measure with 200 hertz per second, and then it's so accurate. Then if we have a normal pattern before and we're doing a follow-up, because for example, father or mother has got this kind of neurodegenerative disease, then this could be an early diagnosis or an early finding.
Of course, it's not an either or. As people age, they'll have arthritic and other orthopedic disorders combined with cognitive disorders, and this machine could tease out both of those and lead towards earlier and better treatment modalities for each specific condition, I imagine.
Yes.